That was my main motivation, Jay.
It's amazing. And, having you and I cross paths during my time at Invasive, and you've now performed more than 1,650 X lifts. Wow. What have you learned? What have you learned from that experience?
And the lateral surgery to the spine actually is a very interesting surgery. And that's why I became so passionate about it, because not only is minimal invasive and is a very challenging in terms of disruptive solution to access the spine, now from the front, not from the back, just this unique corridor that is actually, the body has it, that retroperitoneal is like an amazing highway that you can get into the spine. And obviously the industry get in the middle. As you as an expert on the industry, that when the dollar sign is behind it, a lot of things happen. And, at that time, this company was eroding the market share of the big, 500 gorillas on the field. And right. They have to respond with something. But the problem is that they came with a alternative that actually was not necessarily safer or better. And the complications start having, showing up more and more. And that's why it became to me like, okay, so my role is to show that actually this access, the lateral access to the surgery is safer, but we have to show it in a scientific way. As you know, Jay, I don't get nothing by telling you my patients do great. And then you're going to say, okay, great, Dr. Uribe, good luck, So the question is, how can we make sure that scientifically and with facts, we know that it's actually a good procedure, and not only that, but can be spread to the masses, can be reproducible. And that's what became the challenge for me. And obviously, I like it, and the numbers, doing it for, it's not like I'm abusing the indications. It's just I've been doing it. I started too early with lateral. I've been doing for more than 10 years, lateral access to the spine, and the numbers goes there. And as always, want to push a little bit more on that. What about if we get in the thoracic spine? What about if we try to get more lordosis and we do the, anterior section in the ligament, this and that?
Yes. And interestingly, you're well published, to your point of bringing the data to truly change what surgeons are doing, and your peers in the, out there in their communities and their markets, 142 publications, peer reviewed, 51 book chapters, right? That's incredible. And it takes a lot of time and effort, and I would say just extra things added on to your already busy schedule. So thank you for that, because that spurs innovation. I've talked to other published surgeons, and it's just so great to what you're doing, for not just your patients there in your market, Dr. Uribe, but for the greater good of spine surgery.
Yeah, and Jay, publications is, I would say, in the regular world, is a way that you leave somewhere your job and for the next generations and for the people out there. And also it makes you honest, And if you look at my publications, most of my publications actually are complications. I'm never afraid to show what goes wrong, what happened, trying to understand, and then let the community know, because I'm sure that doing that, I'm protecting others and I'm helping the field. Yes. I don't get nothing again by tell you, oh, my patients do great, I never had complications. Listen, it's like a car driver. If you drive cars, you have to crash.